Dr. Adrija Ganguli, consultant gastroenterologist and hepatologist attached with Neotia Mediplus. Today we shall be discussing about inflammatory bowel disease, also known as IBD. Earlier there was a myth that IBD is a disease of West, but with increasing patients each day, it should be seen that IBD is also a very important disease in Indian context, and there is very less awareness about this disease. So here I will throw some light on few aspects of IBD. IBD basically comprises of two main diseases, Crohn's and ulcerative colitis. Now when do we suspect, as gastroenterologists, as doctors, when we suspect a patient to be having IBD? When the patient is having chronic diarrhea, a diarrhea which lasts for more than a month should be investigated properly, because there are very less infective cases which can lead to a diarrhea of more than a month. Then bleeding PR, bleeding per rectum. Most common reason for bleeding PR is said to be hemorrhoids or piles, but often we miss the diagnosis of a bleeding PR which is a manifestation of IBD mainly, because the stool is often mixed with blood and people think that it is piles, but it is not. So if you are suffering from bleeding diarrhea, if you are suffering from bloody stools, which is chronic, which you are suffering from many months or many weeks, you should consult a gastroenterologist so that IBD can be ruled out. And also, especially Crohn's disease can manifest as strictures, which will have the symptoms of pain abdomen. So any pain abdomen which is distressing enough to lead you to hospitals, to ER visit, should be investigated properly. So when we come out to be investigating these diseases, so there's nothing to be very afraid of, but a colonoscopy in such cases is a must. So by colonoscopy, what we do is we enter your digestive system through anus, and we take a biopsy of the affected areas. Through the biopsy, then the pathologist will tell us whether your symptoms are due to this IBD or not. And some blood tests are also done. So the main thing is that IBD is a chronic disease. It cannot be cured off completely. So if you fall under the trap that somebody will tell you to go to south, to go to north, to go to here and there and do alternative medicines so that the IBD is cured, so they will be fooling you. But IBD can be well controlled. If diagnosed early, patients can lead a very healthy life. So for IBD, it is very important that you consult your doctors so that the diagnosis is early, the treatment is prompt, and you adhere to your treatment so that you can live as normal life as possible.